And we are tracking the latest on the Delta variant as COVID cases continue to surge across the country.
Yeah, health officials now say the variant accounts for an estimated 83% of U.S. COVID cases. Now, that's a steep increase from the beginning of the month when the variant only accounted for about 50% of those cases.
4 confirmed cases of the highly contagious Delta variant in the upstate. That's according to DHEC. Officials say that variant of COVID-19 can be passed to others faster than any other variant, and they really encourage everybody to get vaccinated if you haven't done it yet.
Yeah, Fox Carolina's Carrie Weimer spoke to health officials at Bon Secours St. Francis today to find out what this variant is all about and what you should know on whether or not you are vaccinated. Hey, Carrie.
Hey guys, since the pandemic began, we've been here bringing you information every week on what you need to know. And of course, just as you may be understanding more about the coronavirus, it goes and changes on us. So we stopped in here today to find out what the latest information is on this new Delta variant and what you need to know about it.
Think of it as a small, very small living thing. That living thing wants to keep living. And then we did a few things to make it harder. So we started masking, we started distancing, we started increasing hand hygiene, and then we vaccinated, which was huge. Now this living thing, which wants to keep living, keeps bouncing off of people, especially people that have been vaccinated, and it's not getting what it wants.
The chief medical officer for Bon Secours St. Francis says the Delta variant has similar symptoms as the original version of the coronavirus.
People are going to have the same sense of fatigue, fever, cough, cold, congestion sort of symptoms that they had originally. There's not a good way to tell just by looking at someone or looking at their symptoms to decide which variant they have.
The CDC confirms infections have been doubling since June, on average more than 24,000 a day, and says people who have not been fully vaccinated against COVID-19 are most at risk.
You get vaccinated so you don't have a very severe course of illness or even death.
We found out through DHEC that Delta variant testing is not a routine part of COVID-19 testing. Only randomly selected positive samples are tested in labs for the variant. Officials say that means there are likely other undetected cases of the Delta variant already in our communities.
While it's frustrating to think, am I going to be masked forever? Am I going to be getting a shot every 6 or 12 months? No one knows that for sure, but it is important not to let your guard down. It's important to do as much as you can so you can do all the things that we couldn't do for a little while.
Now, one question we've heard a lot from you, our viewers, is if you're fully vaccinated and you come into contact with somebody who has COVID-19, should you immediately run off and go get tested? Well, we asked and they answered. The answer is no. Unless you are persistently sick for 3 days and are symptomatic, you don't need to run off and get a test. They say quarantine at home, self-isolate, and of course keep up those good practices of hand washing, masking when necessary to avoid spreading it to anyone else. Jarvis, Cody?
Yeah, thanks a lot, Carrie. A lot of good information to know.